Today, we're talking about COVID-19. The public health emergency was declared over in May. So what's next? Here to discuss the latest guidelines and what to do about changes in Medicaid coverage is Dr. Charlene Wong, Assistant Secretary for Children and Families in North Carolina's Department of Health and Human Services. So welcome to the show.
Thank you so much for having me.
COVID-19, this isn't a rerun. No, we're really talking about it now, but it did end the public emergency. And a lot of minds, they're going, oh, all right, let's party. Time to move on. But that's not the case, is it?
You know, what we really want is for everyone to be safe and healthy, particularly as we're entering into summer. And so the thing that we're still recommending, because we still have COVID-19 virus in our community, even though the public health emergency is over, as you said, we still want people to be protected for themselves and their loved ones around them. And the best way to do that is still the updated COVID-19 vaccine.
Well, let's talk about the vaccines. What are the latest guidelines with all things that have changed? And I think Johnson & Johnson pulled their vaccine for whatever reason. But in any case, people are still confused, quite honestly, by all the rhetoric that surrounds vaccines. So what's the latest?
Let me give you the latest. So again, most important thing for people to know is that the COVID-19 vaccines are safe and remain our best protection, again, to protect yourself from getting really sick from COVID-19 and your loved ones around you. For people who are 65 and older or have a weakened or compromised immune system, the recommendation is if they've even already had an updated COVID-19 vaccine, they could be eligible for an additional vaccine dose to give them extra protection. And the reason I keep talking about the updated COVID-19 vaccine is because, as we all know, the COVID-19 virus has changed, and so these updated COVID-19 vaccines give you that protection against some of these newer COVID-19 virus strains or variants that we're seeing in our communities today. So those are for age 65 and older, and those with a weakened or compromised immune system. Even if they've had an updated dose, they might be eligible for another one now. For people 65 and older, if their last shot was more than 4 months ago, or if they have a weakened or compromised immune system, if their last shot was over 2 months ago. For everyone else, it's easier.
Oh, good.
If your last vaccine was before September of 2022, you're probably due for another updated COVID-19 vaccine.
Okay, you know, you're talking about people who are older than 65, but also people that are suffering from, you mentioned immune issues, but asthma, obesity. What are some of the things that kind of stand out that make you more of a high risk for COVID?
Yeah. That's a great question. You know, these vaccines and getting tested and treatment are extra important for people who have some of these health conditions that, like you said, put them at higher risk for getting really sick from COVID-19. Here are some common examples of what we see. People with heart disease, people with diabetes, obesity, asthma, women who are pregnant are at very high risk. It turns out about 2/3 of North Carolinians have some health condition that puts them at higher risk for COVID-19 and getting really sick if they were to have their virus. For these populations, again, it's extra important to be up to date and get those updated COVID-19 vaccines.
Now, you have the other group, people who haven't been vaccinated.
That's right.
What do you say to them?
Now is the time. You know, again, we still have COVID-19 in our communities, and great news, if your age is 6 and older and you've never had a COVID-19 vaccine, all you need is one shot, and you're considered up to date at this point. So now is a great time to go out and get that COVID-19 vaccine.
And this, I would assume, for kids, you mentioned that's a young age. Are they at a high risk, or are these kids who, again, have issues medically that need to be addressed?
So we've seen kids who have gotten really sick, just like adults have gotten really sick from COVID-19. Again, the great news is that we have vaccines available for all children, essentially all children ages 6 months and older. A couple things to know about COVID-19 vaccines for children. So for kids who are ages 6 months to 11 years old, they get a smaller dose of the COVID-19 vaccines than we give our teens and our adults. It's really important that parents talk to their child's health care provider to see if they're up to date, both on their COVID-19 vaccines, and always have to say it's very important to also stay up to date on all the other childhood vaccines as well.
Well, I know as a parent myself, I worry about that. And I bet a lot of our viewers too have had a tough time deciding, well, should I get the vaccine or not? We know that kids, statistically are probably not going to die from it, but they can get very sick. But even then, they are very low risk for that. What's the upside for the vaccine? Do you roll the dice on that? Because we don't know what's going to happen down the road with the vaccine, or maybe we do.
Yeah.
This is a dumb person asking a smart person, help me out. Do I get the vaccine and why? What's the upside?
Yeah. So the upside is that we know is that we have a safe vaccine that works really well for protecting kids from getting really sick from COVID-19. I'm a parent too. No parent wants to have to bring their child to a hospital. We've had the ultimate tragedy of children who have even died from COVID-19. And what an extra tragedy, because this is a virus that we have a really good vaccine to prevent. And any time we have the ability to prevent a child from getting really sick or, in the most tragic cases, dying, why would we not want to use that when we know that it's safe and that it works? Versus the rolling of the dice is really saying, well, maybe let me just see what'll happen if my child gets COVID-19. Because we do know some of the health conditions that put people on average at higher risk, but I've had some patients myself who they don't have any of those conditions, but their children or they themselves have gotten really sick. So it's hard to predict.
It's scary. It's a tough decision to make. It really is, especially with everything that has been said about both the disease and the vaccine. Don't you go anywhere, and don't you go anywhere either, because we have a lot more to talk about when we come back.